My name is Jim, and I have been a patient of Dr. Spiegel's for about 4 years, and I suffer from neuropathy in my feet. It's idiopathic neuropathy, which just simply means they don't know the cause of it. I'm not a diabetic, although I have suffered from it for many years. It started out about 10 years ago when I went to my podiatrist, and he discovered that I had neuromas, several of them on both feet, on the bottom. And he said to me, they're very difficult to handle, they're very difficult to operate on, so why don't we just try some orthotics, which he did. I put them in my sneakers and my shoes, and it worked fine for quite a while. But the numbness in my feet just continued to increase, and to the point where it started interfering with my balance as I walked, and I jogged at that time. Before I actually came to Dr. Spiegel, I was actually in pain at night, severe throbbing, burning pain on both feet, particularly on the tops and the sides. And I had resorted to taking ibuprofen in huge amounts. I was taking 4 or 5 every night to try and ease the pain. And sometimes that didn't work, and I actually went to a tramadol, which is a narcotic, to allow me to sleep. And I knew I had to do something different. So I came to Dr. Spiegel, and he suggested, among other things, a session of what's known as PRP, or platelet-rich plasma. And I researched it. By the way, I have a degree in pharmacy, so I'm familiar with medical terms and medical terminology. I researched it and found it quite interesting. And so I opted to go into this procedure and basically just extracted about 3 vials of my blood, centrifuged out the plasma, which includes platelets, and injected them into my legs and my feet, starting at my knee and going down to my feet. And I did this procedure 3 times at an interval of about 6 weeks. And I started to feel the difference almost immediately, within a week or 2. And I continued the treatment through the entire 3 courses. And my last treatment was February of this year, of 2020. And I have not had a significant overnight pain event, throbbing and burning in my feet since. So it works for me. I don't know all the ins and outs of it. I do know that platelets and plasma are very important to the healing process. I do know that it acts almost like a stem cell therapy, whereas you actually increase the amount of healing nutrients and antibodies in your feet and elsewhere, so that they can heal themselves. The nerves actually heal themselves. And I'm just giving you anecdotal evidence. I can't cite any studies, although there have been studies done in Europe and Israel, quite effective and convincing studies. This is anecdotal evidence that I'm giving you that it works for me. I encourage you to try it because it works, and I'm convinced that it works. Thank you for your time.